happens in relationships when mental health shows up? When you care deeply about each other, but something internal keeps getting in the way? Welcome to Evolve Your Intimacy with Dr. Stephanie. I'm Dr. Stephanie, licensed professional counselor, certified sex therapist, and clinical sexologist. And this is a special series where we're diving into the real, often misspoken ways mental health disorders impact intimate relationships. Throughout this series, we're going to break down some of the most common mental health challenges like anxiety, depression, ADHD, trauma, and so much more, and explore what they actually look like inside a relationship. This is about understanding what's really happening right beneath the surface so you can stop repeating the same cycle and start building something more intentional. So whether you're struggling or you love someone who is, this series is for you. Stay tuned.
Quick quiz. During your last STI test, were you tested for trichomonas, mycoplasma genitalium, oral gonorrhea? Did someone actually swab the back of your throat? Did you do an anal swab? Or did you just pee in a cup and give blood? Because if that's all you did, you were not fully tested, and that is not a minor detail. Multiple studies show oral gonorrhea is more common than genital. Anal chlamydia is frequently missed. Mycoplasma genitalium is almost never included in routine panels. Yet people walk away thinking they're clear. You're not fully tested unless your panel includes blood, urine, anal swab, and an oral swab. Anything less is just incomplete data. At Shameless Care, we built this differently. You order online, a doctor reviews your medical information, a kit comes to your door, you collect the samples yourself, and you send them back to a CLIA-certified laboratory. And if something is positive, that same doctor who reviewed your case handles your treatment. No subscriptions, no half panels, no pretending a urine test covers your throat. 24 board-certified physicians right in your phone. Because knowing some of your status isn't the same as knowing your status. Go to shamelesscare.com and use coupon code EVOLVE. That's shamelesscare.com, coupon code EVOLVE.
What happens when love feels like oxygen one moment and then a threat the next? When a delayed text doesn't feel like a delayed text, it feels like rejection. When a disagreement doesn't feel like conflict, it feels like abandonment. When emotions don't rise slowly, they crash in like a tidal wave. Today, we're talking about borderline personality disorder in intimate relationships. Carefully, compassionately, and without turning anyone into the villain. Because BPD is too much. It's often pain that learned to speak very loudly. And in relationships, that pain creates intensity, confusion, passion, fear, closeness, chaos, deep longing, all at the same time. Borderline personality disorder is often misunderstood. At its core, borderline personality disorder is often misunderstood, and at its core, it can involve intense emotions, fear of abandonment, sensitivity to rejection, difficulty regulating emotional pain, and sometimes a rapidly shifting sense of safety in relationships. In intimate relationships, it might look like a partner feeling deeply connected at one moment and terrified of losing the relationship in the next. A small change in tone, timing, facial expressions, or affection feels enormous. Conflict escalating quickly because the nervous system is reacting as if the relationship is in danger. One partner saying, "I just need space," while the other one hears, "You're leaving me." And this is important. The emotional reaction may seem too big from the outside, but inside the person experiencing it, the pain often feels so real, very urgent, and very threatening. For the person living with BPD, if this is you, let's slow this down and really sit with it, because there's more going on here than just strong emotions. First, borderline personality disorder is more common than people think. Research estimates that around 1.6% of general population has BPD. Some studies suggest it could be closer to 5 or 6% when including undiagnosed cases. In clinical settings, it shows up more frequently. About 20% of psychiatric patients meet the criteria for BPD. And importantly, people with BPD are not dramatic for no reason. There is a combination of biological sensitivity plus life experiences shaping how the brain reacts. When you feel that sudden shift and your chest tightens, your thoughts race, and everything feels urgent, your brain is not calmly evaluating the situation. It's reacting. And here's what tends to happen in the brain. The amygdala goes into overdrive. The amygdala is part of the brain that detects threat. In people with BPD, studies show that the amygdala can be more reactive, especially to emotional or social cues, like the tone of voice, facial expressions, or even perceived rejection. So when your partner takes longer to reply or seems distant, your brain may register that as not neutral, but as danger. Not they're busy, but oh my God, something is wrong. The prefrontal cortex really struggles to regulate in the moment. This is part of the brain that's responsible for reasoning, impulse control, slowing things down. And during the emotional activation, especially in BPD, this system can become less effective, meaning you know logically that something might not be a big deal, but you can't feel that truth in your body. So logic loses emotion. The emotional brain and memory systems link past pain to the present. Your brain is constantly scanning for patterns. If you've experienced abandonment, inconsistency, emotional pain in the past, your brain will quickly connect. This feels like before. Even if your current partner isn't doing the same thing, your nervous system may react as if they are. That's why the reaction can feel immediate, intense, that all-consuming. It's not just about this moment. It's about what this moment represents. And from the inside, when this system activates, your thoughts may sound like they're pulling away. They don't love you. They don't want to be with you. You're going to be abandoned. I need to fix this right now. And your body may feel restless, panicked, overstimulated, desperate for reassurance, or just suddenly shut down and go numb. This is not you being too much. This is your nervous system trying very loudly to protect you. But here's the hard truth. Protection strategies that come from panic often damage the very connection you're trying to protect. So when the urge hits in these moments, that urge might be to send multiple text messages, demand reassurance, accuse, test your partner's love, threaten to leave before they can, or emotionally shut down completely. Those are understandable impulses, but they often escalate the situation instead of soothing it. The skill is learning to insert even like tiny pauses between the feeling and the reaction, not to eliminate the feeling, but to change what you do with it. A more regulated way to respond is instead of reacting from the surge, try translating the experience. From this, you don't care about me, you're ignoring me, to I'm feeling really activated right now. I think I'm scared you're pulling away. Can you reassure me we're okay? That shift does three things. It names the feeling, it removes the accusation, and it gives your partner a chance to respond without defensiveness. Reality versus fear. One of the most powerful questions you can practice asking yourself is this something happening right now, or does it feel like it's something about to happen? Because often that fear of abandonment feels just as real as abandonment itself, but they are not the same. Learning to tolerate that uncertainty, that space between fear and fact, is one of the core challenges and one of the biggest growth points. You are not your most intense moment. You may have moments where you say things you regret, feel out of control, push someone away while trying to pull them even closer, but that doesn't define you. But it does point to where support is needed. And this is where therapies like DBT become incredibly important, not because you're too much, but because your emotional system needs tools that most people were never taught. So a grounding reframe, when it's the intensity hits, try this internal script. I want you to say to yourself, this feels like an emergency, but it might not be one. My brain is reacting to the fear, not necessarily to the facts. I can feel this without acting on it immediately. I can ask for reassurance without attacking. You don't need to suppress your emotions. You need to learn how to hold them without letting them take over your relationship. Your capacity to feel deeply is not the problem. Unregulated intensity is what creates the damage. With awareness, skills, and support, some intensity can become deep connection, emotional attunement, passion that doesn't destroy safety. You're not trying to become less emotional, you're learning how to become emotionally powerful without being emotionally overwhelmed. For the partner without BPD, if you're the partner on the other side of this dynamic, your experience matters just as much, but it's often overlooked. Because from the outside, it can look like you're the stable one. You should be more patient. You should be more understanding with them. And while empathy is important, over-functioning is not the same as loving. You might feel like you have to choose your words very carefully. A small mistake turns into a big conflict. You're constantly reassuring, but never seems to be enough. You're responsible for keeping things emotionally stable. You can't fully relax in the relationship. And over time, that turns into some emotional exhaustion, resentment, shutting down, avoiding honesty to keep the peace, feeling like you're losing yourself. You may love your partner deeply and still feel overwhelmed by the intensity. Both of those can be true. One of the most important patterns is this. Your partner becomes emotionally overwhelmed. You step in to calm and fix, explain, reassure, stabilize. At first, it feels like support, but over time, it can turn into a silent agreement. I will manage your emotions so things don't escalate. That's not sustainable because no matter how much you give, your partner does not have the internal tools yet, so your reassurance will never fully stick. And you'll find yourself repeating the same pattern. Reassure, calm, repeat, escalate, reassure again. That's not connection. That's emotional burnout waiting to happen. The balance is validation without losing yourself. And this is the skill that changes everything. You validate the feeling, not the distortion. So if your partner says, you don't care about me, you're going to leave, don't respond with, that's ridiculous, because that's invalidating. But you also don't want to say, you're right, I have been a terrible partner, because that's over-owning it. Instead, you ground it. I can see that you're really scared right now. That feeling makes sense given how intense this feels. I'm not leaving, and I do care about you. You're acknowledging the emotional reality without confirming that narrative isn't accurate. Your nervous system matters as well. And in these moments, your body reacts as well. You may feel tense, cornered, defensive, overstimulated, or like you just need to escape the conversation entirely. And your nervous system is saying, this is too much. And if you ignore that long enough, one of two things usually happens. You explode or you shut down completely. Neither one of those helps the relationship. So staying grounded isn't about being calm for them. It's about not abandoning yourself in the process. Boundaries, that's the missing piece. And here's where many partners struggle. You're told to be patient, understanding, compassionate, but no one emphasizes that enough. Without boundaries, compassion turns into self-abandonment. Boundaries are not punishments. They are clarity. They sound like, I want to talk about this, but not if I'm being yelled at. I am here, but I need 15 minutes to calm down first. I can reassure you, but I'm not going to repeat it over and over. I'm not leaving, but I do need some space right now. And here's the key. You have to follow through consistently because inconsistency fuels insecurity. If sometimes you engage in the chaos and sometimes you set limits, the relationship becomes unpredictable, which increases the anxiety for both of you. The hard truth is you can't love someone into regulation. You can support, you can reassure, you can show up constantly, but you cannot fix their emotional system. You cannot prevent every trigger. You cannot prevent their every fear or regulate their nervous system for them long term. That work has to be learned internally, often with professional help like therapy. And if you try to take that on fully, you're going to burn out. So what does healthy support actually look like? That's a great question. And healthy support is consistent, not constant. It's calm, not controlling. It's present, but not over-functioning. It sounds like, I care about you and I want to understand. I am here with you, but I'm not going to engage in a fight. I am willing to work on this together. I also need us to respect certain limits so this relationship stays healthy. That combination, the warmth and the firmness, is what creates that safety over time. But here's what not to do, even when you're frustrated. I need you to avoid using abandonment threats. Maybe we should just break up. That doesn't help. Sarcasm or dismissiveness. The silent treatment as punishment. Over-explaining yourself for hours. Trying to logic someone out of an emotional state. When someone is highly activated, they are not in a place to process complex explanations. They need short, steady, repeated messages that are very effective. A grounded response framework in intense moments like this, I want you to think acknowledgement, reassure, boundary. So for example, I can see this is really upsetting you. I'm not leaving and I care about you. I need to take a 20-minute break so we don't hurt each other. And that's it. One pro tip. When you say, I need to take a 20-minute break, look at the clock and set the exact time. We're going to come back here at 2:20 and we're going to talk about this. And at 2:20, if you're not ready to talk about it, then you ask for more time. But you always give that time. Someone who has BPD has a huge, deep, dark-seated abandonment issues. And so when you tell them 20 minutes and then you don't come back in 20 minutes, they're ruminating and they spiral out of control. You just need to provide grounded clarity. Protecting the relationship and yourself. A healthy relationship here doesn't mean no conflict, no perfect emotional control. It means that there are limits, there is repair, there is growth on both sides. You are allowed to say, I love you, and this dynamic isn't sustainable unless we both work on it. That is not rejection, that's honesty. Loving someone with emotional intensity requires strength, but not the kind that sacrifices yourself. The goal is not to become endlessly patient. The goal is to become steady without being rigid, compassionate without collapsing, supportive without overfunctioning. Because real stability in a relationship doesn't come from one person holding everything together. It comes from both people learning how to stand on their own while still choosing each other. So if you are the person with BPD traits, I want you to listen. When you feel activated, I want you to try this before responding. First, we're going to name the trigger. What just happened? We're going to name the story. What am I telling myself this means? We're going to name that feeling. I feel scared. I feel rejected, ashamed, or unwanted. And we're going to name the need. I need reassurance, closeness, clarity, or a pause. Then we're going to ask cleanly, can you reassure me that we're okay? And then I'm going to take a few minutes to calm my body. The goal is not to never feel intense emotion. The goal is to stop letting these intense emotions drive the car. If you are the partner of someone with BPD traits, you have to stay calm, but don't become cold. Use short, steady statements. I love you. I'm not leaving. This conversation is getting too intense. I want to continue when we are calmer. I will come back at 7:30. Don't make promises you can't keep. Don't use abandonment threats during conflict. And avoid saying, I'm done. I can't do this anymore. Maybe we should break up. Unless you genuinely mean it and are prepared to follow through. For someone with an abandonment fear, those words can land like an emotional dynamite. Be honest, be boundaried, and be consistent. Let's talk about how BPD can affect our sexy time. This is an important conversation because sexuality in relationships with BPD is often intense, meaningful, and complicated, not just physical. And it deserves to be talked about without shame. The core pattern, intensity carries into intimacy. The same emotional intensity that shows up in conflict often shows up in physical closeness too. So sex can feel deeply connected, emotionally consuming, reassuring, validating, or even stabilizing for the moment. For someone with BPD traits, intimacy isn't always just about pleasure. It can also feel like, now I know we're okay. Now I know we're close again. Now I know I'm wanted. Now I'm not being abandoned. So sex can become tied, not consciously, but emotionally, to safety and reassurance. And when intimacy becomes that emotional regulation, this is where things get a little tricky. During those moments of insecurity or fear, there can be a strong pull towards physical closeness as a way to reconnect quickly, reduce anxiety, feel validated, avoid emotional distance. So instead of, let's talk through what just happened, the impulse might be, let's reconnect physically so I can feel secure again. And while that can feel good in the moment, it can create a pattern where sex becomes a way to regulate emotional distress instead of addressing it. And over time, it can lead to confusion for both partners. So there's this push-pull dynamic, and intimacy can follow that push-pull pattern. Wanting closeness very intensely, then suddenly feeling overwhelmed or vulnerable, then pulling away, then feeling disconnected again. This can look like a very passionate connection followed by emotional distance, feeling extremely close during sex and then unsure afterwards, or craving intimacy but also feeling exposed or unsafe in it. And from the outside, this can feel really confusing, but from the inside, it often feels like, I want this so badly, but it also feels like a lot. Sensitivity to rejection. Sexual moments can carry a lot of emotional weight. So things that might feel small to one partner can feel huge to the other. Not initiating, turning down sex, being distracted, not seeming fully present, changes in frequency. All of that can be interpreted as, they're not attracted to me, they're losing interest, I'm not enough. And even if that's not what's actually happening, again, it's not about the overreaction, it's about how the brain interprets the signal through a fear of abandonment lens. For partners with BPD traits, it can help to gently separate physical intimacy from emotional reassurance. So ask yourself, am I wanting closeness right now, or am I trying to soothe fear? Neither is wrong, but they are very different needs. You might say, I'm feeling a little disconnected and I think I need emotional reassurance before physical closeness. Or, I want to be close, but I'm also feeling a little vulnerable. Can we slow down? That kind of awareness builds real intimacy, not just intensity. And for the partner without BPD, you may feel pressure, spoken or unspoken, to use sex as a way to fix tension, prove love, reassure your partner, avoid conflict. And that can get complicated quickly because intimacy works best when it's mutual, safe, and unpressured, not when it feels like, if I don't engage, something will go wrong. I care about you and I want us to feel emotionally connected too. I don't want intimacy to feel like pressure for either one of us. There is a healthier version of intimacy, and at its best, intimacy in a relationship with BPD traits can be deeply connected, emotionally attuned, passionate, present, grounded with that mutual safety. But it does require emotional regulation outside of the bedroom, clear communication, boundaries around pressure or avoidance, and honesty about what intimacy is being used for. So a simple check-in for couples before or after intimacy, let's try asking this. Did this feel connecting or regulating? Are we okay emotionally, or are we avoiding something? Do we feel closer in a steady way or just temporarily better? Those are questions to keep intimacy from becoming a Band-Aid. Sex can feel incredibly powerful in relationships where emotions run deep, but it shouldn't be the only place where connections feel safe. Because real intimacy isn't just about closeness in the moment. It's about feeling secure, respected, emotionally held. And even when you're fully clothed, having a hard conversation and choosing to stay grounded together. This week, I want you to create a relationship regulation plan. When we get activated, we will, number 1, name what is happening. We're in the cycle. Number 2, pause for 20 or 30 minutes if needed, and make sure that we give the exact time we're coming back. Number 3, use one reassurance statement. Number 4, actually return at that specific time. And number 5, repair with one question. What did you need from me in that moment? Write it all down when you're calm, because in the middle of a fight, that's not the time to build the fire escape. Borderline personality disorder can bring intensity into love. But intensity does not have to mean destruction. The same heart that fears abandonment deeply may also love deeply, attach deeply, and long for connection deeply. But healthy love cannot be built on panic. It has to be built on honesty, regulation, boundaries, repair, and support. So if you are the partner who feels everything at full volume, you are not too much to love, but you are responsible for learning how to hold your emotions without handing them to the partner like a weapon. And if you're the partner trying to stay steady, your compassion matters, but do so with your limits. Because the sexiest kind of love is not chaos. It is safety with heat, passion with respect, intensity with emotional maturity. That is where love stops being like survival and starts feeling like a place both of you can finally breathe. If this episode resonated with you, don't just sit with it, use it. Take one piece from today and bring it into your relationship this week. Because insight without action doesn't create change. Intentional behavior does. If you want deeper support, tools, and structured guidance, you can explore my workshops and relationship resources at evolveyourintimacy.com. And if this episode helped you feel seen, understood, or gave you the language for something you couldn't quite explain, share it with your partner. Sometimes the most powerful way to start a conversation is not by finding the perfect words, but by pressing play. And if you haven't already, make sure you follow the podcast and leave a review. It helps more people find this work and start changing the way they show up in their relationships. Until next week, stay connected, stay curious, and stay intentional about the way you show up in your most intimate relationships.